People from culturally and linguistically diverse backgrounds often face additional barriers in accessing healthcare and wellbeing services in Australia. Australia's increasing cultural diversity demands that more inclusive health and social support services be utilised to overcome the multiple structural, practical and cultural barriers present. The World Wellness Group is a Brisbane-based organisation that recognises this challenge facing multicultural populations. In 2019, the Multicultural Connect line was developed to address these barriers and concerns. The helpline provides information regarding physical and mental health support, legal and resourcing services for callers in their preferred language. Our research will contribute to the scholarship on the effectiveness of culturally appropriate service provision by conducting a process evaluation of the Multicultural Connect line. The research questions that guided this project were: how does the Multicultural Connect line operate, and what areas of practice could be strengthened further? 7 employees participated in semi-structured interviews representing a rich sample with diverse educational, professional and linguistic backgrounds. Cultural competency is a core value of the Multicultural Connect line. Our participants expressed how the World Wellness Group values behaviours, attitudes, policies and structures that enable people to work effectively cross-culturally. Facilitators in delivering culturally competent services include speaking different languages, building trust and empathy, upholding safety, active listening, showing respect and passion for support.
I can connect to people. I can be on the same level with them. I can use simple English and assess the situation culturally, and then I can give them a culturally informed response.
The MCL staff understand the fears and concerns amongst culturally and linguistically diverse individuals about linking to mainstream service providers. However, the Multicultural Connect line's culturally informed framework overcomes these barriers. Cultural awareness through self-reflection allows the World Wellness Group to foster successful, diverse workforces using cultural difference as a strength for more effective decision-making, innovation and adaptability. Simultaneous bottom-up and top-down advocacy is crucial in enabling health professionals to advocate for systemic changes and to ensure fair and equitable access to services. The Multicultural Connect line's work involves advocacy at the system level to support the protection of clients because, as one participant noted,
systems fall down for multicultural communities who don't have the language skills or the understanding of the system.
The Multicultural Connect line staff also work with clients at the individual level to provide the necessary skill set for them to lead an independent lifestyle and to be able to advocate for themselves. This approach to advocacy actively creates spaces for voices, opinions, wants and needs, which contribute to broader systemic changes. Through our interviews, we saw our participants' ability to provide integrated psychosocial support to clients while upholding responsive multicultural principles. One interviewee told us about an exchange with a client which occurred over several calls in their own language.
I don't know how to get to Centrelink. I'm a new mother and I have a very small baby.
What payment are you on? What visa are you on? Who else lives with you? Why did you move to Brisbane?
By exploring this story on the helpline, the caseworker discovered the client was a victim of domestic abuse but didn't know there was a term for what she was experiencing. The caseworker was able to then connect the client to a variety of services to help her. This case highlights the complex and intertwining challenges often presented on the MCL, including visa limitations, language barriers, lack of knowledge and understanding of available services, and the lack of a bank account. Activism is needed to protect vulnerable clients from further victimization and to support their empowerment. Interviews revealed 2 aspects that enabled participants to work cohesively. The first was informal communication and decentralized collaboration with colleagues. The second is professional development training.
We work closely to one another and provide feedback in real time. When we get a call, we'll say, "This happened, it was a bit tricky," and we'll talk to our colleagues. Like a case review opportunity, it's very collaborative and the decision making is such that you're not alone.
we recommend the following strategies to continue to strengthen the MCL's service delivery and encourage more holistic, culturally sensitive, and patient-centered service provision. Firstly, more structured induction for MCL employees to equip them, as well as prioritising regular professional development days. Secondly, collecting data to connect more client demographics, cultural identity, and service use for engagement with government agencies, and to improve recognition of what the World Wellness Group does. Thirdly, expanding the peer support role to improve rapport with communities for open dialogue on client services.